It is very important to keep germs from spreading to people and objects. The procedures used for this are called infection control. You are probably familiar with some standard infection control procedures from your own experiences. Not drinking from a glass someone else has used. Changing bed linens when someone new is going to sleep in the bed. Using a different washcloth and toothbrush for each member of the family. There are two kinds of infection control procedures: standard precautions and transmission precautions. Standard precautions prevent the spread of infection through the body, body fluids, secretions, excretions, mucous membranes, and broken skin. Washing your hands regularly is an example of a standard precaution that all caregivers should always take. Transmission-based precautions prevent the spread of infection by interrupting the way in which germs are spread. For instance, to prevent infection from germs spread through the air or germs spread by droplets, such as through sneezing and coughing, the caregiver should wear a mask. Wear a gown or apron to provide direct care. Limit the client's contact with others. Use special care in disposing of equipment and supplies that come in contact with the client. Germs, or microorganisms, are living plants or animals so small they can only be seen through a microscope. Examples include bacteria, which can cause illnesses like strep throat and staph infections, fungi, which create yeast infections and athlete's foot, protozoa, which can cause diarrhea, and viruses, which spread infections like colds, HIV, and hepatitis. Viruses are very small organisms that can be particularly difficult to kill. Germs grow and multiply in certain kinds of environments. They like places that are warm, moist, and dark. They need oxygen and a food source. These conditions can exist in or on a person's body, or in the objects they use, such as a wet towel. There are several stages to infection by germs. First, a pathogen, that's a germ that causes disease, must be present. Second, there must be a reservoir where it can live. Third, there must be a portal of entry or exit, some place where the germs can get in or out of the body. Fourth, the pathogen must be transmitted to another person. This can happen through the air, like sneezing, through direct contact, like touching someone's hand, or through indirect contact, by touching or using an article that has been used by an infected person. Fifth, the newly infected person must be susceptible to infection by the pathogen, that is, weak enough to become infected. Older clients, clients with HIV, cancer, or diabetes, or anyone with a medical condition may have a weak immune system and be very susceptible to infections. Nosocomial infection is an infection that develops while being hospitalized. The patient is weak and when exposed to an article contaminated by another patient, acquires an infection. A benefit of early discharge from a hospital is that there is less chance of the client acquiring this type of infection. How can you tell if a client has an infection? Look for the signs, which can include fever, swelling, an increase in pulse, rapid breathing, pain or tenderness, loss of appetite, rash, sores on mucous membranes, that is, the lips and inside the mouth, redness, and discharge or drainage from an area. Infection and inflammation are two different things. Inflammation occurs when a portion of the body experiences some kind of trauma. It turns red and may feel warm to the touch. It swells and becomes painful. A good example is a sprained ankle. It becomes inflamed but is not infected. For that, there would need to be a germ inside the ankle. A wound can be inflamed and not infected, but if it becomes infected, there is a strong likelihood that inflammation will also be present. Remember, all infections are caused by some type of germ. The client's body might heal itself, or the client might have to take an antibiotic to kill the germ. Washing your hands is something you've been doing your entire life, but hand washing for client care needs to follow a set procedure. Doing it right helps prevent infection for both the client and for you. When should you wash your hands? After going to the bathroom. Before starting work. After completion of the day's work. Before and after each meal. After blowing your nose or sneezing. After handling soiled items such as linens, clothing, or garbage. After contact with items contaminated with blood, feces, or other body fluids. After removing gloves. And between clients. The purpose of hand washing is to stop the spread of germs from person to person or place to place. Equipment and supplies you will need to perform this procedure are liquid soap and paper towels. Gather these items by the sink where you'll be washing. Use a clean paper towel to turn on the water and adjust the temperature. Remember, your hands have germs on them already, so you don't want to touch the faucet directly. Warm water is just as effective for cleaning as very hot water. Wet your hands with your fingernails pointing down. This allows germs to run down and into the sink. Apply the soap. Liquid soap is better because bar soap can harbor germs. Lather well, keeping your fingertips pointing down. Rub your hands together in a circular motion to create friction. This is important for a very good hand wash. Wash carefully and thoroughly on your palms, backs of hands, and between your fingers. Rub fingernails against the palm of the other hand to force soap under the nails. Keep washing for at least 15 seconds. With fingertips still pointing down, rinse the soap off. Be careful not to touch the inside of the sink. There are germs there. Dry your hands using a clean paper or cloth towel. Use a clean paper towel to turn off the faucet. Don't use your bare hands or they will become infected by germs on the faucet handle. Finally, apply hand lotion. This prevents your hands from drying out and cracking, which can happen when you are washing your hands thoroughly several times a day. In some clients' homes, there may not be sinks with running water to wash your hands, or the sinks might be too dirty to use. A good substitute is using disposable wipes or towelettes that contain antiseptic solution. These are often called waterless alcohol-based hand washes. Use of these wipes is a real time saver. These wipes can dry out your hands, so it is a good idea to follow up with hand lotion to prevent cracking. Your office should provide any personal protective equipment you need in order to give safe client care. Another critical practice for preventing infection is the use of gloves. Gloves should be worn during procedures in which you have contact with body fluids. This might include mouth care, perineal care, emptying a commode, and changing wet, soiled linens. Vinyl gloves come in a wide range of sizes. For sensitive hands, powderless gloves are available. Your gloves should fit snugly, not too tight, not too loose. If too tight, they will break easily. If too loose, germs can get inside. Your office or client should supply you with gloves. If not, you will need to buy them yourself. The only equipment you need are the gloves. To put them on, first wash your hands. With your dominant hand, pull out one glove and slide it onto your other hand. Use the gloved hand to pull out another glove and slide your dominant hand into it. Interlace your fingers to make the gloves comfortable and adjust the top of the gloves to stay flat. Remove gloves with care. Remember, they have been exposed to contaminants and infectious germs. You don't want to touch the outside of them with your bare hands. Use your dominant hand to grasp the opposite glove on the palm side, about an inch below the wrist. Pull the glove down and off so that it is removed inside out. Keep holding half the glove with the fingertips of the gloved hand. Using your ungloved hand, insert the fingers into the inside of the remaining glove and pull it down and off, inside out. The glove you are holding with your fingertips is now inside the glove you are taking off. Drop both soiled gloves together into the waste receptacle. Finally, wash your hands. Remember that not only your skin, but also your clothing and the air you breathe need to be protected from contamination. For this, you need personal protective equipment, a mask, safety goggles, a disposable gown, and gloves. To begin, wash your hands. Adjust the mask over your nose and mouth. Your mask must always be dry. If the mask becomes wet, replace it. Unfold and open the gown so that you can slide your arms into the sleeves and your hands come right through. Grasp the two strings at the back and tie into a bow, not a knot, so that the strings can be easily undone later. Reaching behind you, overlap the two edges of the gown so that your uniform is completely covered. Then secure the waist ties in the back of the gown. Apply the gloves, as already described. Finally, put on the goggles. Remove the mask and gown carefully. Remember, the goal is not to touch the outside front of the mask and gown, which may have been contaminated during your work. Begin by untying the waist strings in the back of the gown. Then, remove your gloves. Wash your hands. Remove goggles. Remove mask. Drop the mask in an appropriate waist receptacle. Now, untie the gown's neck strings and loosen the gown at the shoulder. Slip the finger of your right hand inside the left cuff without touching the outside of the gown and pull the gown down over your left hand. With your left hand, pull the gown down over your right hand and then right arm. Fold the gown with the contaminated side inward. Roll it into a ball away from the body and dispose of it in the appropriate waste receptacle or red biohazardous bag. Finally, wash your hands. Remember, these gowns are disposable and can only be worn once. Discard the gown at the end of your work session.
Hello, I'm Candace Rotolo, and welcome to our program, Infection Control in the Home Setting. Many people believe that the home is the ideal setting for health care. At home, your client is surrounded with familiar furniture, familiar people, familiar sights and sounds, familiar germs. In your own home, there is a sense of control and of being safe from intruders and uninvited guests. In your own home, you are safe from the germs of other sick people as long as the home health aide who visits you is careful to wash their hands before and after visiting each of their home care clients. In home care, there is still the risk of client-to-client infection, even though the risk of spreading infection from client to client is not as crucial in the home setting as it is in long-term care or hospital settings. As a home health aide, you also need to worry about transmitting infections from you to the client, from the client to you. Always remember universal precautions. From the caregiver or family member to the client, from the client to the family or caregiver. There are other challenges in home care and infection control. The home is the client's territory. You may need to teach family members how to keep the client and the home clean. Very touchy territory telling a wife that her home needs to be cleaner or the foods that she is serving her sick husband may not be helping him to heal. Or in the client's home, you may have the responsibilities of managing laundry and preparing meals. In some ways, the types of home health aide responsibilities and the types of clients we see in home care today are different than those 20 years ago. In this program, we will examine infection control and home care. We'll start with 3 key ideas in the home setting: clean, cost, and common sense. Then we'll address specific home health aide responsibilities, including assessment of a home, client hygiene, laundry, preparing food and washing dishes, cleaning the client's environment, disinfecting client care equipment, and disposing of wastes. Let's start off with 3 ideas to remember in infection control in the home: clean, cost, and common sense. To clean means to remove all visible dirt and material from an object. When you clean, you remove dirt, grime, grease, body excrement, and fluids. In the home, cleaning is usually sufficient. You do not need to do extensive disinfecting, as is done in a hospital or long-term care facility. Disinfecting means to kill many or all disease-causing microorganisms, except their spores, from an innate object. In the home, cleaning is key to breaking the chain of infections. The second key idea in home infection control is cost. In home care, the client pays for cleaning supplies and laundry. Bar soap and water are fine for hand washing in most cases, as long as the soap dish allows for drainage. Detergents contain ingredients that kill many bacteria, fungi, and spores, so use detergent in water. You don't even need to use hot water many times. Multiple washings in very hot water can damage some fabrics, and you may wear out the client's clothing or linens unnecessarily. The third key idea in infection control is common sense. Use your judgment in the home setting. If the client or their clothing or their equipment or their immediate environment is dirtied or soiled, clean it. If it doesn't look clean or it doesn't smell clean, then clean it. Approach caregivers and teach them the importance of keeping the client and their surroundings clean and dry. Clean, cost, and common sense. Keep these in mind as we examine specific responsibilities you have for infection control in the home. Infection control in the home can be broken down into the following areas: assessment of a home, client hygiene, laundry, preparing food, washing dishes, cleaning the client's environment, disinfecting client care equipment, and disposing of wastes. We'll emphasize what you need to report to your nursing supervisor, as well as the resources your nursing supervisor will provide you with for proper infection control in the home. Assessment of a home. Assessing a home means to check it out in terms of equipment and features that help or hinder your infection control efforts. It is an evaluation, and based on the evaluation, you may find that you need to bring certain supplies before you can start client care. The best way to assess a client's home is to walk through it, look, and ask questions when you need to. Start with things that are important to protecting you and your client, things you need to carry out universal precautions. First, somewhere to wash your hands. Where's the sink? Is there running warm water? Is there soap? Can the client afford paper towels? Where is the waste container? How close is the sink to the client's bedroom? And how many people in the home use the sink? Do they usually wash their hands before and after doing any client care? Are there a bathroom sink and a kitchen sink? If hand washing facilities are not available in the house, talk with your supervisor about getting waterless hand washing agents that are available in gels, foams, and towelettes. Use these, and when you do get to the nearest sink, wash your hands thoroughly. Now let's review the steps to take for proper hand washing. Before you begin hand washing, it is important to keep your hands in the proper condition to best deter potential infection. Keep fingernails trimmed short so it is easy to remove the bacteria and other microorganisms that collect under them. Long fingernails are more difficult to keep clean, and they rip gloves easily and make you more likely to become in contact with infectious agents. Rings or other jewelry harbor microorganisms too. Keep jewelry to a minimum when you wear your uniform. First, make sure you have hand washing facilities available, a source of running water, soap, and paper towels. Second, turn the water on. Think of the faucet handles as reservoirs of bacteria, so you don't touch them again once your hands are clean. Third, wet your hands. Your hands should be lower than your elbows. Do not reach up to wash. You do not want water to run up your arms. The water should keep flowing down your fingertips. Fourth, apply soap and rub it all over surfaces of the hands, wrists, and lower arms. Wash your hands for 10 to 15 seconds. That's about the time it takes to sing Yankee Doodle Dandy. Vigorously rubbing together all lathered surfaces, including between your fingers, your thumbs, backs of the fingers, backs of the hands, and beneath the fingernails. If hands are visibly soiled, more time is needed. Fifth, rinse your hands in a flowing stream of water. Again, do not reach up. Let water flow down your fingertips. Sixth, dry your hands off carefully with clean paper towels and discard them. Seventh, using paper towels, turn off the handles of the sink and throw away those towels. Do you need gloves? That is, do you expect to be exposed to blood or other body fluids? Universal precautions are very important in the home. Wash your hands before and after you wear gloves, and wear gloves for any procedure that may expose you to blood or other body fluids. Do you need other personal protection equipment with this client, like gowns or aprons or masks, goggles? Your supervisor will tell you. Third question, what about food preparation and storage? Is there a refrigerator, a stove? Good nutrition is important for maintaining healthy body defenses. Just as importantly, food that spoils because it is not stored or prepared properly is a reservoir of causative agents of infection. Raw meat, mayonnaise, milk products, and eggs. All foods carry microorganisms. The last thing your client needs is a case of diarrhea with a gastrointestinal infection caused by improper food preparation. Fourth, what kind of cleaning agents are in the home? Are there sturdy gloves that you can wear when you use strong agents like bleach? Fifth, what is at the home for washing dishes? Sixth, how about laundry? Is there a clothes washer and detergent, bleach, a clothes dryer, a clothesline? Seventh, waste disposal concerns. Is there a toilet? Does it flush? How are the garbage and other solid wastes removed from the home? Is there a problem with insects or rodents? Maybe the garbage attracts these pests. Finally, if the client requires specialized medical equipment like oxygen or walkers or bedside commode, is it in the home? Are there instructions for cleaning it? is the name of the company that supplied the equipment available in case you need to contact them about cleaning or maintenance. Is there a place to store them so they will stay clean and safe? These 8 questions are important for assessing a home and having the equipment and facilities available for safe practice. If any of these are not available, talk with your nursing supervisor. Also ask your nursing supervisor if your agency has written procedures to follow when you give care to each of your clients. You had infection control information when you oriented at your agency. See if there are specific ways that your agency wants you to follow through. Now let's discuss client hygiene. Client hygiene is another aspect of infection control. Make sure clients wash their hands before eating or putting items in their mouths. Maybe this has always been a practice for you, but something that the clients or caregivers do not feel is important. Emphasize that when a person is ill or disabled, he or she is more likely to develop an infection, so household members and the client need to be extra careful with hand washing. It is very important to have clients wash their hands after using the toilet, commode, or urinal. If you need to, assist them to the sink or bring them a soapy washcloth and have them rinse their hands in the wash basin with water. Make sure that female clients know how to wipe themselves from front to back so they do not carry microorganisms from the perianal area to the urinary tract opening. Improper cleaning can result in urinary tract infections. Clients who are incontinent, who have no control over their urine or bowel movements, must be cleaned thoroughly after each episode of incontinence. This is because microorganisms from the anal area spread to the urinary tract, where they cause infection. Urinary tract infections are a common problem among elderly home clients. Urine is also very irritating to the skin, as we all see with a baby's diaper rash. Clean, dry skin is healthy skin, and healthy skin is a good defense against skin infections and skin breakdown. When you bathe a client, be sure to dry in skin folds like the groin or under a woman's breasts. Laundry. Good hygiene also means clean, dry clothing and bed linens, sheets, pillowcases, blankets, and mattress pads. Clients' clothing can become wet from spills, sweat, urine, or other body fluids. Wear gloves whenever you handle clothing or linen that is soiled with body fluids. Wash clients' clothing and bed linens separate from other household members' laundry. Clothing and linen that is soiled with a bowel movement should first be emptied into the toilet, then soaked in bleach for 20 minutes, then washed in soapy water. All other clothes or linens that are soiled with body fluids should be washed with a 20-minute pre-soak in bleach too. If bleach is not available, many detergents contain ingredients that kill bacteria and fungi. Washing machines are a huge help to the home health aide who tries to provide a clean and sanitary environment. If no machine is available, wash laundry out in the sink and hang it on a clothesline to dry. Preparing food may be another one of your responsibilities. Food can serve as reservoirs of infection-causing microorganisms, especially when the food is not handled properly or not stored or cooked at the right temperature. Foodborne infections can also occur if the equipment used to prepare or cook or serve the food is not clean. Storing foods properly is important. Foods need to be stored above floor level, and check expiration dates on food. Frozen foods that have defrosted should not be refrozen. Dairy products or open cans of tube feeding formulas need to be refrigerated. Microorganisms may thrive in foods that are left on a counter instead of stored in the refrigerator. So be sure to chill cooked perishable food leftovers within 2 to 4 hours after preparation. Wash your hands before handling foods, and especially after handling any raw foods. Whenever you are preparing raw meat, be sure to wash the cutting board and knife thoroughly in hot soapy water before using that same cutting board or knife to cut vegetables or other foods, especially foods that you would not cook. Better yet, use one cutting board only for raw meat and another for other foods if this is feasible. Cooking with the right temperature is important. Make sure that the chicken and fish are cooked sufficiently so the meat is not pink. Even chicken and fish, which often harbor the salmonella bacteria, are harmless when cooked properly. When you reheat foods, reheat them rapidly. Washing cooking equipment and dishes. All equipment used to prepare foods needs to be cleaned thoroughly after use in warm soapy water, then rinsed thoroughly. Home care clients with infectious diseases may use regular family dishes and utensils if they are washed in hot soapy water and then rinsed. Rinse the dishcloth or sponge in clean water each time you wash the dishes and store it so it dries. If there is a dishwasher, this is good, for dishwashers use hotter temperatures and are very good at cleaning dishes. Let's talk a little more on cleaning the client's environment. Other important things in the home that you must keep clean are toilets, sinks, equipment used by the client, and environmental surfaces close to the client. Each time you clean an object, you help fight the battle against infection. Clean any item whenever it is visibly soiled. If blood or feces or other body fluid is on the object, clean it immediately, since some microorganisms, such as the hepatitis B virus, are very powerful and stay alive in dried blood. Disinfect objects after cleaning. We'll talk more about disinfecting in a few minutes. There are many ways to clean, that is, to remove dirt and other visible contaminants. Elbow grease or manual cleaning is your personal effort in cleaning. When you are cleaning, wear sturdy gloves to protect your hands. Clean the gloves when you are done, and wash your hands after you remove the gloves. Warm water and a detergent are suitable for most cleaning chores. For client equipment, see the manufacturer's instructions. Things like walkers, wheelchairs, canes, and braces usually are cleaned with warm water and detergent. If the object has crevices or small openings, you will need to use a brush or cotton swab or other gadget that will help you clean out that opening. Microorganisms like to hide in there and multiply. There are several agents that can be used for disinfecting in the home. Your choice depends on cost, what you are cleaning, and common sense. Boiling water. Bleach, 1 part bleach to 10 parts water. Isopropyl alcohol, 70%. Phenolics, Lysol is an example. Hydrogen peroxide, 3%. White vinegar, 1 part vinegar to 3 parts water. As you may already know, the bleach solution, 1 part bleach to 10 parts water, is effective against microorganisms that cause serious life-threatening illnesses like the hepatitis B virus and the human immunodeficiency virus, HIV, that causes AIDS. Common household disinfectants are powerful weapons against infections in the home when they're used and used properly. You choose the disinfectant according to the item you are disinfecting. You need to read the labels on the disinfectant and follow the manufacturer's directions to find out what items you can safely clean with it. Can you dilute the disinfectant or not? How long do you leave the item in the disinfectant in order for it to be effective? What safety measures do you need to take when you use it? Before you clean and disinfect an item, think, where am I going to store it once I clean it? Placing a clean cup on a dirty counter doesn't do anybody any good. Many times we need to clean off counters, tables, and other surfaces so we have a clean place for our clean items. And how often should you clean? Remember our 3 main ideas: clean, cost, and common sense. One rule of thumb is ask yourself, does it look clean and smell clean? If not, clean it. Sinks, toilets, bathtubs, and showers should be cleaned whenever they are soiled. For regular household cleaning, like floors and walls and furniture, once or twice a week is usually sufficient unless they become visibly soiled. Disposing of wastes is another responsibility of the home health aide. Basically, all waste needs to be put into the correct container to prevent it from harming those who handle it. All waste is contaminated with microorganisms, so remove it from the client's immediate surroundings and handle the waste as little as possible. The toilet and sewage system are designed to handle contaminated wastes like vomit, feces, and urine. Carefully empty these and any urine collection containers or commode buckets into the toilet, pouring slowly so you do not get splashed. When clients are incontinent and soil their sheets or clothing, Empty the solid waste into the toilet before laundering the linens or clothes. Be sure to wear gloves when handling these items and wash your hands thoroughly after removing and discarding your gloves. Any disposable items that are contaminated with blood or other body fluids, like tissues that are filled with sputum or disposable bed pads, should be placed in a plastic bag, sealed tightly. All needles and sharps should be placed in a hard-sided container with a secure cover. Handle needles and sharps as little as possible and never attempt to recap a needle or break or bend a needle. Also, check with your supervisor to see what your home health agency's policy is regarding disposal of wastes. In summary, we've addressed specific responsibilities that you have with all of your clients. These actions will help prevent many types of infections in your home care clients, such as urinary tract infections, gastrointestinal infections, and infections from blood-borne pathogens. Think about clean, cost, and common sense as you carry out your day-to-day client care activities. You will break the chain of infection and protect your client's family, and yourself. I'm Candice Rotolo. Thanks for watching.